Hello, everybody. As you heard at the beginning of this session, my name is Luke Hassan. I'm an accredited practicing dietitian from Melbourne, Australia. I currently work mainly at Active Health Clinic, and I have been working with individuals with invisible illnesses, including Ehlers-Danlos syndrome and hypermobility spectrum disorders, for the better part of 5 years now. What we're going to talk about in this presentation is integrating dietary advice and formulating your nutrition plan. We've been through so many amazing topics today. Everything from understanding food types and digestion to nourishing the EDS body and understanding supplementation to exploring gastrointestinal concerns and optimizing comorbidities like dysautonomia and MCAS to managing nutrition in light of specialty areas that contribute to food challenges when we live with EDS. So finally, some of the more practical strategies that can assist us, and of course, hearing from some of our wonderful community voices. And there's still more to come. But the question remains, where do you start with your personal nutrition journey? How do we choose from all the things that we've heard today? What's most important? Well, we begin where any good investigation begins, and that's by asking some more questions. Before we can formulate your nutrition management plan, we really need to understand more about what you need to focus on with your nutrition. To begin working on things in an effective and efficient way, it's often too broad to say that my nutrition is poor or I can't eat enough. These issues can certainly be part of it, but we need to be a bit more specific, particularly when there can be so many things going on in hypermobility and EDS. Specifically, we need to formulate a couple of questions that we have about our nutrition based on what we're finding challenging with our food now eating at the moment. We can then put these questions through a filter that will allow us to address the most important things first and find an appropriate support at any stage of the journey when we need it. The truth is that there are many ways to go about formulating your personal nutrition plan. And today I want to propose to you just one. As you can see, I've used a spin on the who, what, when, where, why approach. Instead, I've gone with the why, where, what, when, and who approach, with the intention being that we're asking ourselves these questions to help us formulate our nutrition plan. These questions are, why do I want to work on my nutrition? Where is my nutrition and health currently? What is the priority to address right now? When do I need to seek support and who do I seek that support from? If you're taking notes, this slide might be a good one to write down or screenshot as we'll be following this flow through the talk. The purpose of this is to try and give you a framework that provides you the opportunity to get started with your plan yourself in a structured way, allowing you to maintain gains as you achieve them and continue to move forward when you're able. The first step in formulating your management plan is ensuring that you have a good understanding of why you want to work on your nutrition and or what you want modifying your nutrition to do for you. We can class these things into two categories, goals and impact. Your goals are more nutrition or health related. They might be reducing gastrointestinal symptoms, eating more consistently, reducing inflammation, or eating better for my body. Perhaps there's some other things, but these often sound like very medical, very health related targets. And these goals are great. But when I'm seeing a patient for the first time, I'm honestly more interested in the real reason why they're sitting in front of me, what they're hoping the impact of achieving these goals will be. These might be things like being able to go out for dinner and eat with my friends, being able to think more clearly in class or even get back to school, being able to be more spontaneous about how I do food and the things that food surrounds, and being able to spend more time on my hobbies or work instead of being worried or struck down with these symptoms that food seems to cause. Once we have a handle on nutrition goals and what the impact of achieving them will be, we need to understand where you sit with the foundations of nutrition and what your current nutrition status is. We need to know about things like your energy and protein intake, but also very importantly, the variety of your diet. So how much of the food supply you're actually consuming. And this is where things like micronutrients, fats, fibers, carbs will all be met if there is adequate consistency and variety in your diet. We also want to assess how adequate your fluid intake is, which is a very important element, particularly in these conditions. Earlier today, we heard from Jessica around self-assessment tools and testing. Some of that might be useful in this conversation. There will undoubtedly be elements of your nutrition that are impacted by your health conditions as well and your wider health status. And it's important you spend some time understanding what you know about your health and what you're confident to manage about your health. You also want to be really clear on what you don't know about your health and what you're still in the beginning of managing or figuring out about where your health currently sits. Putting it all together from those first two questions will look something like this example here. And after getting this out on a piece of paper or your computer screen or even in your mind, you should have a good idea of your nutrition goals and the impact that achieving them will have on your life, and how near or far you currently are from those things, as well as what you need to consider from your health and your diagnoses. And this provides us with a good starting point for your nutrition journey and will help you to know what you're actually aiming to address as you start to work on your nutrition. With that information in hand, we're now at the point where we need to decide what the priorities to address are. To do so, very shortly, I'll take you through a few case studies from work in my clinic where we've been through the questioning process and formulated a plan for a patient's nutritional care. And you might notice these themes that I'm about to talk to you about emerging from the structure of our day so far, as we dive into what's been prioritized in the plans of these individuals and how we've actually gone about structuring what comes first in those plans. So you'll remember that session one was largely about ensuring that the foundational pieces of our nutrition are in place for EDS and HSD. And this is being the priority of nutritional care when we're thinking about what we need to do with our nutrition. Session two discussed the comorbidities of EDS and HSD and how we need to consider them in our nutritional journey. And session three and four so far have shed light on some specialist areas that are sometimes key to unlocking the barrier to increasing our nutrition, or at least having an impact on how well we're doing with our nutrition. I also want you to note the relationship that exists between these themes as we walk through these case studies, as I believe this overall concept will be vital to you being able to formulate your own management plan. So, with that said, let's jump into some case studies. So, this patient came to me having been told it was a good idea to see an invisible illness dietitian, but not truly understanding what they really wanted to achieve out of that. So, the process of answering those first questions was really important in putting the nutrition information and health considerations for this person into context to form a solid nutrition plan. You can see here in the nutrition information, there's a lack of consistency in intake, and that's driven by how hard food is to consume for this patient due to the variety of reasons you can see under the nutrition info and the health considerations there. This resulted in significantly restricted food intake, particularly in micronutrients, and to a lesser extent protein. The sensory and texture considerations with this individual mean that they won't eat things like red and green colored foods, which rules out a whole lot of highly nutrient dense vegetables and red meat. Chicken is fine though for this person. And due to the comorbid conditions and symptoms and the high level of fear avoidance, because this person had a lot of food reactions and negative responses, they became very adverse to actually trialing new things, which is understandable. The plan for this individual centered around regulation. First, of the nervous system, with some really tangible strategies that this person was actually willing to engage in that didn't revolve around challenging what they ate initially, but rather helped their body to be better at accepting the food that they were eating, which helped this person to realize that there was things that they could do to help their nutrition without actually immediately changing what they were eating. But as you read further into this plan, as you'll see, these initial strategies are designed to overcome or work around some of the barriers that existed to increasing nutrition variety and quality for this individual. And this is why they had to come first. It simply wasn't going to be something that they were willing to engage in if we didn't change the way that the body was responding to food. This patient, however, came in with a really good understanding of what they wanted from dietary therapy. They'd already done a significant amount of modifying their own nutrition and understood that they were now at a point where they really didn't want to keep going the way that they were going with managing their condition with their nutrition because it was becoming so incredibly restricted amongst a variety of reasons. So they decided to seek out informed support. And I make that clarification between the two cases because it's important to know that for each of you, for each person, there's going to be a different time where actually seeking support is necessary, is desired, and that's okay. But we'll get more to that in a moment. If we look at the nutrition information and the health considerations here, you can see that this person presents with a significant number of the comorbidities that we see with EDS, with HSD, and that invisible illness cluster. And unfortunately, this came with a large degree of medical trauma that made engaging with new health professionals really, really hard for this person. They'd managed a lot of their symptoms through restricting a lot of foods, as I mentioned, but they recognized that this was unsustainable. And going on in the assessment, it was clear to me that we really weren't going to be able to make the significant nutrition changes to get them back towards adequacy and achieve the impact that they were after from changing their nutrition until this person was able to have better medical care for their MCAS. That was the significant limiter. So I referred this person to an MCAS specialist. The thing is that the wait time over here in Australia for my preferred MCAS specialist is between 12 and 18 months. So while we were waiting for that, this person was still going to be super unwell. Because of this, we had to plan to engage in some strategies that their body was going to tolerate until we had medical management on board and adequate medical management on board to give some time and space for the body to deal with some of the things that they were consuming and a lot of the environmental and stress triggers that they were inadvertently engaging with and decrease the reactivity. And once we got that MCAS specialist on board and we got some medical management in place, I'm really pleased to report that for this person, they were able to really increase their dietary variety and their intake of a bunch of different foods. It's still not perfect, but it's coming a long way. So it just shows what the partnership between the nutrition work and the specialty support can really do to help someone, which is really awesome. Both of these cases are really good examples of answering the priority question. And the fact is that we're very rarely going to have a straightforward nutritional picture in hypermobility and our associated conditions. There are always going to be this if buts and what abouts. And that still leaves us with this question, what do we do first? Well, there's a couple of analogies here. I like to go with the lowest hanging fruit analogy. Basically, we start with what we can reach for, what's within our grasp right now. And if there are clear barriers that are going to take time to work through, like fear avoidance for that first individual or specialist wait times for the second, we can often find other things, tangible strategies, like creating consistency in what you can eat or expanding within safe foods that are approachable now and will move you towards your goal. Another way to put it, as I know Lorna likes to, is the idea of picking your battles, following the path of least resistance toward your goal, one step at a time. Because when we're working on reducing MCAS reactivity, for example, or supporting the connective tissue, or stabilizing the nervous system through any number of strategies or tools or educational pieces that you have heard today. We are working towards the common goal of allowing the body to respond better to food and improving your nutritional uptake, helping you to achieve those foundational nutritional pieces that we discussed in session one today. In the same breath, meeting those foundational nutritional needs will allow for better management of your hypermobility and associated conditions. I think that there's one thing that's really obvious from this talk. It's that there's never going to be a one-size-fits-all approach to nutrition in EDS and our related conditions. And each of you have a each of you have an individual story, an individual journey. And the pause there comes from thinking about so many patients that I've seen over the years. These zebras come in many forms, so it should be no surprise that an individual tailored plan is going to be necessary for each of you when it comes to your nutrition journey. And this is why, as a dietitian with experience and expertise in this hypermobility space, I really advocate for not providing an off-the-shelf, one-size-fits-all meal plan or even management plan to patients. Even if I think of those two case examples, their plans might have similar themes, even similar parts to them. But even still, there are never two nutrition journeys that are identical, and you can see that through those case studies. I think the tendency for most people is to simply not think of getting help with their nutrition. After all, food is something that's pretty personal and we do every day of our lives, hopefully. And everyone has experience with it. So why would someone bother? The fact is, and you've heard today, there's so much information out there on nutrition, and all of this can become very overwhelming and confusing, not to mention the amount of misinformation that's out there as well. And I won't get into that right now. But I think an important question to ask is, when do you need to seek support for your nutrition journey? The way that I explain this to people is essentially whenever you hit a bump in the road. And this might look like many things. It might be right from the beginning when formulating your goals and impact, like it was for our first case study, or it might be figuring out how your hypermobility and or your related conditions are actually impacting your nutrition that triggers oh, I need to see someone about my nutrition. Or perhaps there's a piece of the puzzle, like a symptom or a food reaction that doesn't seem to fit. And things aren't adding up, and that might be when you decide to do this. I think put simply, when things don't feel right, you feel your nutrition habits aren't serving you as well as what they could, either in general or specific to the conditions that you live with, or if you just don't know what needs to change, or even if change is required, reach out for support. It's there for you. So it's important that we seek out appropriate expertise from a dietitian, nutrition professional that has the appropriate qualifications. And I fully understand I might be missing a few titles here, and from around the globe, I did what I could to research, but I'm really sorry if I'm missing your title there. But we need to ensure that the registered professional also has experience in the hypermobility and invisible illness arena. Obviously, a bunch of us have talked here today, but there are others. There are registries out there hosted by various organizations, including the Ehlers-Danlos Society. So that might be a good place to start. I think just a very quick note, the specialist support that you require, as was talked about in the last session, sometimes to get that specialist support from a nutrition perspective, you're going to need to see a nutrition practitioner, accredited practicing dietitian, whatever they might be, who is actually a specialist in that particular specialist area, and not necessarily the hypermobility space. Hopefully they'll have a crossover understanding, but there's always a case where two dietitians, nutritional practitioners can actually work together, one from a hypermobile perspective, one from the specialist perspective. And off the back of Mel's presentation just before, I think if you are neurodivergent, seeking out someone who's neuroaffirming and has this as a hallmark of their care can make all the difference in having a plan that's formulated in a way that's right for you too. So to summarize, formulating your nutrition plan includes understanding why you want to work on your nutrition, where your nutrition and health conditions currently sit, what the priority is to address, think the lowest hanging fruit, even amidst the specialist support, when to reach out for support, and who to see to tailor your nutrition plan to you. And if that's what you walk away with today and you remember those 5 points, I'm really, really happy. These are my contact details. You'll get them anyway. And as always, thank you for your attention after this long day. I hope it's been a wonderful and informative day for you and that this session has added to that. Thank you.